This is Health 54, the program that lets you in on health-related issues across the 54 African countries and the globe, right here on your digital-first Pan-African News Network, TOS Television. I am Rose Audu, and you're watching Health 54. On Health 54 for this week, according to a UN report, vaccine inequality between countries and regions may likely pose significant risk to an already uneven and fragile global economic recovery. The United Nations Economic Forecast, published on Tuesday, stated that while the outlook for global growth has improved, the ongoing impacts of the pandemic as well as inadequate progress on vaccination in poorer countries are putting recovery at risk. Similarly, the world economic situation and prospects, media reports warned that escalating inequality is threatening global growth. Projected at 5.4% in 2021, vaccine inequality between countries and regions is posing a significant risk to an already uneven and fragile global recovery. Timely and universal access to COVID-19 vaccination will mean the difference between ending the pandemic promptly. A target of vaccinating 60% of the population in COVAX AMC eligible countries by March 2022 is expected to gap a cumulative of $10.3 billion. This is expected to be sufficient to achieve worldwide herd immunity under a baseline scenario with limited mutation. To this end, bridging the 350 million course gap in COVAX AMC eligible countries will require additional $4 billion grant funding for COVAX AMC. This is in addition to the existing donor commitment of $6.3 billion, thereby making $10.3 billion funding commitment to this project. This, according to a new World Bank report, would be sufficient to control the pandemic, stating that the additional $4 billion would allow the COVAX AMC to raise its minimum vaccine coverage to about 30% of the population of these countries. And after so many days without cases of COVID-19 death, Nigeria on Wednesday recorded yet another death from the novel coronavirus disease, bringing the total number of deaths to 2,066. This is as the country also recorded 47 new cases, increasing the total number of infections recorded in Nigeria to 165,559. The Nigeria Center for Disease Control gave the update Wednesday night on its Twitter handle. The new COVID-19 cases were reported in 4 states, namely Lagos with 28 cases, Rivers 14 cases, Akwa Ibom 1, and Ekiti 1. A breakdown of the data shows that 16 people were discharged Wednesday after testing negative for the virus. This brings the total number of discharged persons after treatment to 156,374. According to the NCDC, Nigeria has tested 1,977,479 since the beginning of the pandemic of February 27, 2020. Meanwhile, Nigeria has said the second dose of the Oxford AstraZeneca COVID-19 vaccine would soon be administered on eligible men and women who have received their first shots. The country has so far received about 4.4 million doses of the vaccine. And still on Health 54, the African Center of Excellence for Genomics of Infectious Diseases in the Redeemers University, Ede, Osun State, has found the Indian COVID-19 variant in Nigeria. The director of the center, Professor Christian Happy, made this known in a notification dated April 25, 2021. This is a test conducted in the university and sent to the Nigeria Center for Disease Control. Happy noted that the center informed the NCDC about the development 3 weeks ago. Happy, however, clarified that the strain in India has 2 more mutations than the one identified in Nigeria, which makes the one in India more aggressive. Recall that Kenya and neighboring Uganda had recently reported some cases of the Indian COVID-19 variant, warning citizens to ensure they obey all laid down COVID-19 prevention protocols so as to contain the spread of the deadly virus. We have found 5 sequences of the India B1617 in the country, specifically in Edo and Osun states. What we have is the B1617 from India. That is the variant they had, but that variant has now evolved beyond the mutation that we identified. The one in India evolved by 2 mutations. It is the same strain with India, but their own now has a couple of mutations. So it is the same as what we detected, but as different in characteristics, Professor Christian Happy stated. Experts have said that MDMA, which is commonly known as a party drug, could be more effective than therapy alone at treating post-traumatic stress disorder. The results of a keenly awaited trial suggest 2/3 of people no longer qualified for a PTSD diagnosis after treatment. The study represents a significant step towards approval of the drug in the US. But UK experts warn against overhyping MDMA's potential, saying more research is needed to understand its effects. PTSD can be as the result of a very distressing or frightening event or longer-term series of experiences that might include accidents, abuse, rape, combat, or illness. And it can be very difficult to treat. This trial, run by U.S. charity, the Multidisciplinary Association for Psychedelic Studies, found 88% of people had a meaningful reduction in symptoms, and 67% no longer qualified for a PTSD diagnosis at all after 18 weeks and 3 seasons of MDMA-assisted therapy. Soaking therapy alone led to a significant improvement in 60% and remission in 32% of people. The trial also compared MDMA with a type of therapy not recommended by the NHS for trauma, making the comparison less useful, according to some UK psychiatrists. This is TOS Television Network, and you're watching Health 54. Do stay tuned. Welcome back. This is TOS Television Network, and you're still watching Health 54. South Africa is on the brink of a 3rd wave of coronavirus infections, driven by a steady increase in new cases after a 4-day holiday weekend that saw millions of people travel to see family and friends and attend religious gatherings. New infections climbed 46% in the past week, with cases rising fastest in the Northern Cape and Gauteng, the country's most populous province. The National Department of Health said Wednesday in a statement. According to them, we have not yet hit the 3rd wave. However, we are at risk, and we have hence need to be on heightened vigilance as a country. And the federal government in Nigeria reports has shown that at least 4.5 million Nigerians are at risk of contracting tuberculosis every year, as there are still over 300,000 tuberculosis missing cases in the country. According to the report, a single person with untreated TB can infect between 10 to 15 people yearly, hence putting at least 4.5 million Nigerians at risk of contracting the disease every year. It further stated that only 11% of persons with drug-resistant tuberculosis are on treatment, leaving 89% of them in the community. It is against this backdrop the federal government is calling on critical stakeholders to ramp up efforts and collaborate through financial support, technical support, to qualify and kick tuberculosis out of the country, as there are currently a funding gap of 70%. The national coordinator of the National Tuberculosis and Leprosy Control Program, Dr. Chukwuma Anyeka, made this known during a workshop by the Stop TB Partnership in collaboration with Treatment Action Group and the NTB-LTP of the Federal Ministry of Health on Monday in Abuja. And a major trial to detect one of the most elusive and deadly ovarian cancer disease has failed to save lives after 2 decades of work. The researchers at University College London said the results were a disappointment. They made a declaration while thanking the over 200,000 people who participated in the exercise. The trial had looked promising, with annual blood tests detecting cases of ovarian cancer earlier. But routine screening for the cancer is not a distant prospect. Ovarian cancer is tricky to diagnose because the symptoms are easily mistaken for less serious health problems. These symptoms ranges from feeling bloated, a swollen or painful stomach, feeling full when eating, the urge to urinate more frequently. According to the trial's lead investigator, Professor Usha Menon, some women are diagnosed so late they are too sick to start treatment. This, therefore, is a wake-up call to all women, especially women of childbearing age, to make routine checkup a priority in order to maintain a healthy lifestyle. It took 31-year-old Sanaha Marathi half a day to book an appointment online for a COVID-19 vaccine. It was a game of fastest finger first, she says. The slot filled up in 3 seconds, but the hospital cancelled her slot at the last minute. They had no vaccines. Marathi went back to try for another appointment. All 18 to 44-year-olds in India have to register on the government's CoWIN platform to get vaccinated. With demand for jabs far outstripping supply, tech-savvy Indians are even writing codes to corner elusive appointments. Marathi can't code, but she is among millions of Indians who are on the right side of the country's digital divide, unlike hundreds of millions of others who don't have access to smartphones or the internet currently to only route to a jab. Prime Minister Narendra Modi's federal government has opened up vaccinations for some 960 million eligible Indians without having anything close to the required supply. More than 1.8 billion doses. Worse, the severe shortage comes amid a deadly second COVID wave and warnings of an impending third wave. And in Brazil, a health regulator recommended officials stop giving AstraZeneca a vaccine shot to pregnant women as authorities investigate the reported death of a woman in Rio de Janeiro who had received this vaccine. And Visa, as the regulator is known, said that the use of the shot on pregnant women should be immediately suspended, according to a statement on its website late Monday. On Tuesday, the health ministry said in an emailed note that it was notified by Rio de Janeiro officials of the incident and is looking into the alleged death, which was first reported by a local media outlet. The ministry said that the occurrence of adverse effects is extremely rare and lower than risk presented by COVID-19 and will continue to recommend pregnant women get vaccinated. But the immunization of those without comorbidities should be reassessed. And that is all on Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, do visit www.tostvnetwork.com. Do follow and like TOS Television Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS Television Network. Remember, health is wealth. So till I come your way next time, do stay healthy. I am Rose Audu, and thanks for watching.